Dr. Abi, just before we start answering questions, I have a question I've always wanted to ask. So I hear birth control and I hear family planning. Are they the same thing? Do they mean the same thing? Or I don't know if you can just maybe explain further what they are. Are they the same thing or are they different? I hear this a lot: birth control, family planning.
Well, technically they're the same because if you're using anything to control your birth, you're actually trying to plan your family.
Okay.
Now, but you can also separate it and look at somebody who's not married. Now, if you are in the African context, if you're in a family, is either you're married. I mean, we're getting to the point where people don't have to marry and living together, but in the African context, it usually comes with marriage. So family planning means that one, you decide that, okay, we are married now, we don't want to have kids until 2 years. What is the best way for us to do that? So you plan your family. In 2 years, you have a child and you say, okay, you know what, the next one will be in 3 years. And then you go on another form of contraception. So birth control is technically the same, but you can also argue that for somebody who's not married, so they don't want to. So, I mean, to be honest, they're the same word. They just use very differently. It's the
Okay.
same, yeah.
Okay. So we'll just go through the questions. I think the first question I see here is from Oriofe. Okay, I don't know if you can see it. So she
Yeah.
says, okay, okay. So I don't know if you want to go ahead or should I read out the question?
I think the question is I'm sporting or something like that. I asked a question about sporting on Nexon earlier. Okay. So I think there are a few questions I might want to ask Oriel Fair, with so next plan non
Okay, so I can see her question here.
sorry,
It
next
says
plan.
implant. I have a next plant implant and I had it for over a year. I recently started seeing some spotting. Why all of a sudden? So after I implant, she's
Um
seeing some spotting.
so I think what I would advise her to do is that now see implants are hormones. I want to believe that the people that put it in, one would have verified the expiry dates, would also have verified whether there was no problem in our reproductive system before they gave her. Now, but hormones are notorious to either alter your periods or make you spot. But what you don't want is that you don't want to assume that it's the hormone that did that. So if somebody comes to me, the first thing is to make sure that there's no other reason why they are spotting. So I will suggest that she goes to her doctor, let her doctor see her, scan her, or examine her, and make sure there's no other reason. Then if there's no other reason, the doctor might want to start her on some complementary hormones just to let the just to also complement the effect of the next planon before they start talking about removing it. So it depends also on the experience of her gynecologist with issues like this. But the first thing is to make sure there's no other problem. The second thing is to say, okay, has this expired or has the activity went off? Do I need to remove it or change it? And the next thing is, for example, if she just put it in like 6 months ago, and they know that there's no problem, they might want to add some hormones to our medication just to help the implant to regulate for some time before they take the hormones off. But it can be normal, but you need to make sure that there are no other reasons. That's what I will advise her to do.
Okay, thank you so much, Dr. Abi. I have another question. I think you mentioned this during your when you were teaching us on birth control. So someone said, can a man do family planning as well? So I think you've answered that question, but just in
Yeah,
case you can just say it again.
let me answer it again. So a man can do family planning either by going through the withdrawal, no, by either doing the natural method with his wife, going through the withdrawal method in a man that is very principled and stuff like that and can hold his own ground, then yeah. And then it can either, if it's completed his family, he can also suggest that he goes for vasectomy. Now, let me explain vasectomy. Vasectomy do not affect your sexual function, okay? So a lot of people are worried that if they go and do vasectomy, they might not be able to have a normal sexual intercourse. Vasectomy do not affect your potency. It doesn't affect your ability to have an erection or anything like that. It only affects the sperm, meaning the sperm cell, not necessarily, the sperm will come out or the liquid will come out, but it will not have any sperm cell in it. So the sperm itself, when the sperm comes out, the cells are part of the sperm. There are other things that make up the sperm. So you will still ejaculate. It's just that the cells will not be in combination with everything else. That's all.
So I have a question from John. It's still on vasectomy. It's asking, is it reversible?
The answer is yes. The answer is no and yes. So I'll say no and yes. So when you're signing your consent form, they will tell you that vasectomy is irreversible. So you have to be sure that you've made a decision. Now, from the surgical point of view, is it reversible? Yes, it's reversible, but it's likely that you will not get sperm even if it's reversed. Because, see, our body is funny. So the sperm is formed and it has to go through our system. So if the sperm is prevented from going through our system, then it starts looking at the sperm cells as a foreign body. So when they join that pipe again and the sperm is trying to go through, your body will start creating antibodies to fight that sperm. So you'll be looking at this as a foreign body. So even if you join the pipes together, you're unlikely to get very good quality sperm. So if you decide that you want to have children in the future, rather than join and go through a surgery, I would just say go for IVF, where they can go and get the sperm without joining the tubes together. That's a more easier process. You can go to the fertility clinic and they can extract sperm from you without going through surgery that might not work. That's what I would suggest.
Okay, thank you. So Orafa is asking another question. She said, I used the Nova ring when I lived in the US and loved it. Can I get it here? What are the costs?
That's a problem. That's a problem.
So
that's a problem with Nova ring. So Nova ring is not easily available in Nigeria. That's one of the problems. A lot of people use it and they're happy with it. What you might do is that you can work with your gynecologist in the country that you're coming from and bring some with you. That's the best thing to do. Or tell your gynecologist over here to work with your gynecologist in, I think Nova ring is more popular in America than in England. So it's more popular in America. So you can work with your gynecologist or your health provider over there and get some. And then the doctor in Nigeria can, if you have any problem, can help you address that. But getting it easily in Nigeria is very hard, quite hard.
Okay. I have something from Miss Derry. Do IUD implant copati affect your chances of getting pregnant if you have had it in for a long time, say 5 years?
The answer to that is no, it doesn't. So but what you need to do as well is that you need to make sure that, so the only way IUD can affect your fertility is that if you're sexually active and you now get a sexually transmitted infection, or during insertion, they inserted it and you got infected. That's the only way it can affect you. If that didn't happen, then no, IUCD, once you remove it, you're back to your fertility rates immediately. So, and it's one of the highly used contraception, efficient and not as complicated. So yes, it doesn't affect your fertility at all. And also, it's actually, most people will advise you to use it for 5 years, but as you get older, let's say you put it in and you're getting to your 40s, you can actually use it for more than, it's licensed to be used for 10 to 12 years. So you can actually leave it in for 10 to 10, 12 years. The copper, not the Mirena, the copper IUD. So you don't have to always remove it every 5 years. All right, thank you.
Okay. Okay. Let me just, because we have about 12 more minutes, so I'll just quickly scroll through. Do you offer birth control services? Is it covered? Yes, we do offer birth control services at South Shore, sorry, at South Shore Women and Children's Hospital. You can send us a DM to book an appointment to see a gynecologist, or you can give us a call. Our numbers are on our bio on Instagram as well. So yes, we do offer that, and it depends on what HMO plan you're under. It should cover as well. Okay, so what kind of family planning can you advise for someone who has PCOS?
Okay, so I think with PCOS now, I think the first question I'll ask that person is that how does that PCOS affect her? So if she can just tell me now, if your PCOS is affecting your period and making your period all over, then I think the best contraception for you will be the pill, because the pill, you can use the pill to control your period. There are also now, in some people that have PCOS, they have excessive body hair. So there's some contraceptives that are designed to help with that as well. So my answer to that way, it depends on what symptoms you're having with the PCOS. If it's mainly hormonal, body hair and stuff like that, then I will recommend the pill. If it's because you're not maybe your how else can PCOS affect you? Yeah, that's the main thing, the hormonal part. But if it's not affecting you in any way, let's say you have your period regularly, it's normal, it's not heavy, then you can pretty much use any type of contraception. You're not exempted from any. I hope I've answered your question.
Yes, I think you have. Okay, so I think she came back with the symptoms she's having. Regular menstrual period, acne, and bloating. Okay, so if you have
Yeah.
more questions, we have 10 more minutes. We can quickly answer your questions before we go off.
So just answer Prosperina again. So I think with her, I will advise her to use the pill, but it's not so she needs to see a good gynecologist and advise her. So there's some pills that are deliberately made or are very good for PCOS because they can reduce the testosterone level, or they can work with testosterone level and reduce it. And that is what causes all the acne and stuff like that. So it's not just any pill. It's some pills are better than some when it comes to polycystic ovary. But I will suggest the pill. Now, just for me to talk about the pill as well, I think a lot of people in Africa believe that the pill, once you start using contraceptive pills, it's frowned on, it's not safe, it affects your future chance of getting pregnant or your family. That's not correct. In young people in Western world, in America and England and Germany and everywhere, young people tend to use more of the oral contraceptive pills. They actually use it a lot more. It doesn't make you promiscuous. It doesn't do anything. It just basically you're protecting your body just in case you have intercourse and not. I think one of the things that we don't do well in Nigeria, and it has consequences, is that we get pregnant. We have a lot of unplanned pregnancy, meaning that, I mean, thank God that, I won't say that, a lot of people after getting pregnant now go and do terminations. And then during the termination, which is the abortion, they damage their womb. And by damaging their womb, they then struggle to get pregnant in the future. I'm just thinking loudly that if you had used contraception and you do not get pregnant, you will not get to the position where you're going around trying to find somebody that can correct the damage that's been done during the attempt of the abortion that you had. So if you had not gotten pregnant, you would not have had your wombs kind of damaged. That's what I mean. Thank you.